If you don't focus on health, your performance will inevitably decrease. Like you said, you were fine in your 20s, but then like, no, we ran out. So did you know that in the UK, it's called postnatal depression and not postpartum depression? I didn't know that. If you did, amazing, but I didn't. And today's guest went through that really in a bad way many years ago. And she thought it was her destiny. She was on medication after medication. But then something happened when things got really bad. She had an epiphany and she climbed her way out of it and eventually got off all her medication. And many years later, she started helping women all over the world. Angela Foster is my guest today. She's an award-winning nutritionist, health and performance coach, keynote speaker, and host of the High Performance Health Podcast. Initially, she was like a high-level corporate lawyer, and eventually she became an industry leader in biohacking and health optimization. So you won't want to miss her story because her story was amazing, riveting, and inspiring. And at the end, she's going to give you a link so that you can learn some things about yourself as well. So let's go. Angela, thank you so much for being here. I'm so excited to have you.
I'm so excited to be here. It was amazing when you came on my show. We had so much fun. And yeah, it's just great to be with you again.
Tell everyone where you're recording from.
I am recording from Surrey in the UK, so not far from London.
Not far from London. Amazing. So your story is absolutely fascinating, and I have the privilege of talking to the coolest medical disruptors in the world, and you are one of them.
Thank you.
So first, like in one sentence, tell us what you do, and then we're going to walk backwards from that.
Okay, cool. So now, didn't do this for many years, but now I host the High Performance Health Podcast, and I help women juggle the demands of their careers and family life and really optimize their health and longevity so that they have high energy to achieve their goals.
What? We need to help juggling? It's so easy to do everything.
So easy, isn't it?
It's so easy. And then I saw that you also work with HRV. Is that a big part of what you do?
I do, yeah. HRV plays quite a big part in our program because we look at HRV metrics because you can only really, coach out your performance to your level of recovery. And that's a really non-invasive way, as you know, of looking at someone's recovery levels and just how much energy they've got to bring to any one day.
Okay, so tell everybody what HRV is.
Okay, so HRV is heart rate variability, is what it's called, is like a measure of looking at the difference between heartbeats. So if someone was listening to this, and they're thinking that they know what their resting pulse is, or they could easily find that, right, by measuring with their fingers on their wrist, and they got the average, which is 60 beats per minute, they may assume that means that there's one beat every single second, but actually the heart doesn't beat in that way. In fact, there's quite high variability between heartbeats. And the more variability we see in general, there are cases, right, where it would be a bit scary to have very high heart rate variability. But in general, the more variability there is, the better. And the better you are able to meet the stresses of daily demands. When there is stress going on, whether that's kind of physiological stress or mental stress, psychological stress, all these different forms that we're subjected to, then the heart tries to create more order if it senses disorder, and you get more of this rhythmic metronome-like activity. And so a really good way to measure what's going on in your body is to look at heart rate variability, and it's super easy to do.
Oh my God, I love this. So I just want to say two things to my audience. One, if you're feeling your pulse and it's truly erratic, that is not heart rate variability. That's a 911 call. Okay, so if it's like really all over the place, that's not what we mean. Heart rate variability is hard to measure just by putting your finger on the pulse. You kind of need wearables to be able to
100%. Yeah, 100%.
So if you're feeling it with your fingers, please call your doctor. So,
yeah. And if you're feeling it in your chest, right, and it's like, it feels like it's skipping around everywhere, please call your doctor.
That's not like,
that's not normal.
Great HRV. I'm just going to sit here and have a heart attack. That's not that. Okay. Okay, good. And then the other thing I want to say is, someone explained HRV to me once in a way that I thought was really cool. Like when you're marching, like at war, things have to be really synchronized. But when you're calm and relaxed and zen-like, there's a bit of like an undulation, and that's what you're going for. So the more undulation there is, the better your health is, right?
It's a great analogy, yeah.
Because otherwise people are like, no, don't we want it to be synchronous? So, okay, so how did you get into this craziness? What drove you into the world of medical disruption?
Yeah, it's a really good question. So I started out as a corporate lawyer for many years, right?
Get
And corporate
out.
law,
That's
I did. Yeah, I was a corporate lawyer in London, and I was working crazy hours, doing like mergers and acquisitions across time zones, crazy stuff, which was like all-nighters, weekends of work. And that was fine. In my 20s, I don't know about you, Dr. E, but like I felt pretty invincible. I think you can take a lot in your 20s. Yeah. And so it was like a real, like lawyers are work hard. I think it's the same with doctors, right? Work hard, play hard. That's the mentality.
Yep.
And you can kind of survive anything. And then when I had my kids, so I had like a whole background of PCOS, endometriosis, problems hormonally. So I had to have surgery. And then when I had surgery, they were like, okay, if you want to fall pregnant and start a family, now is your best time, because they'd kind of drilled my ovaries, lasered out all the endometriosis. And they were like, next 6 months is sort of your best chance. So I got to it. I was going for partnership in the law firm at the same time. And I was like, okay, well, you know what? I'm going to go for these two big goals, a baby and partnership. Why not? Superwoman. So I'll see which one comes in first, right? Probably not both, but maybe we'll get one. And then they both happened. So I was 8 months pregnant when I made partnership, which was, yeah, I mean, that's an achievement insofar as I think very progressive, right? Making me a partner. Particularly then,
100%.
this is a long time ago now.
You weren't hiding it. You was clearly out there.
It was, 8 months. There's no hiding it, is there? So, yeah, so that was all good. And then because of my background, right, with endometriosis and stuff, my gynecologist said to me after I had my son, don't wait too long, go back on the pill, which we can talk about. I think being on the pill was not a great idea in the first place, but go back on the pill for 6 months, come off, and then let's just see what happens. And then I was pregnant again. So by the time I was due, we have like a 1-year maternity leave in the UK. So by the time I was due to go back to work, I was 3 months pregnant.
Oh, good.
That didn't kind of make them too happy, to be honest.
No, I can't imagine.
Yeah. So, but anyways, one thing that I didn't expect, like really didn't expect, was to suffer with postnatal depression, which I did.
Wow.
Yeah, that was a big surprise to me because I was always a really high energy person. And then during my second pregnancy, it actually got really bad. And I remember Googling, is there even a thing as prenatal depression? Like, is that a thing? And found that it was a thing. But I sort of persevered through. And then when my son was about 8 months old, I remember my husband was taking some time off. And I like called up the doctor and I was like, I'm so tired. I can't get out of bed. This is not like me. My PJs till like 3 o'clock in the afternoon. This is crazy. What's going on? And I said, you've got to check my iron. You've got to do this, just in full denial. But ultimately, that's what I had. And I had to work quite hard after my second child really to get over it. And then I had my third child, took a bit of a break, then had my third child. And that's when it hit me hard. What happened to the law
partnership at this point?
Well, so I transitioned out and I thought I'm going to become a judge. I was actually eligible to become a judge. So I was looking into that. And then with the depression and everything, I was like, I'm going to take a career break at this point. I didn't feel like it fitted very well with my life at that point. And so I got my health back on track after my second child. And my doctor was, I'm not sure you should have any more. There's this expression, isn't there? A woman knows when she's done. And I did not feel done. So we had another child. And then I got postnatal depression again. But here's the thing. I put in place all the things that I was told, like, get a maternity nurse, don't be up at night, do all these things. And I think some of that may have been driven hormonally. But this time it became really entrenched. And so 2 years later, I was still struggling with depression and I was under psychiatric care and they were trying to control for bipolar episodes. So I was getting these extreme highs, extreme lows. And so I was then not just on antidepressant medication, but also on antipsychotic medication to control for these moods.
Amazing.
So this was quite extreme.
Which have no side effects. So that's good.
Which is just, awful side effects. I remember the night sweats. I remember like taking the dose. They sort of started me on a starter dose. And they were like, this should be enough. Then they had to double it, then double it again. And I was just so, wiped out. But then I think I'd got to this point, right, where I'd kind of created a prison in my own mind because I didn't see a way out. I was having loads of therapy. I was on loads of medication now. And I just couldn't get out of this prison in my own mind. And I thought my kids would be better off without me. So I thought I'm just the weak link here. And that's obviously a destructive path. And it then started to have an effect on my physical health because the kids got flu. I picked it up and then I ended up with pneumonia. So they were treating me at home with pneumonia. And eventually it got so bad that they called me into the hospital and said, look, we've done a chest x-ray. All we can see is your lymph nodes look really big. We can see this. They're showing me like the ground glass presentation. And I sort of like flippantly, I guess, said, well, you know, I've got pneumonia. Why do you keep talking about my lymph glands? Sorry. It's like you think I've got lung cancer or something like that. And they said, well, it's hard to say you don't without a CT scan. So then I was taken for a CT scan, and it turned out to be viral and bacterial pneumonia, but it was over both lungs. And it was at that point, a very long way of saying to you, how did I get into this? When I was lying in hospital, hooked up to oxygen, I didn't know at that point that they thought they would have to intubate me. My white blood cell count was so low, I was neutropenic, that I got to this point, and I remember my kids had just been to visit me, and I looked at photos of them on my phone, and I felt this overwhelming sense of love and this deep desire to see them grow up. And it was like a shock. Do you know what I mean? Like, what have I been doing? I've got to get well. And that was the defining moment for me. And you know what's so crazy?
What?
Is that within 48 hours of me making that decision, my white blood cell count started to rise.
100%.
Shows you, right, the power of the mind.
Oh, yeah. I mean, I'm hearing this. First of all, you could tell I'm enthralled because I always interrupt people, and I didn't interrupt you. I was like, I was like getting me the popcorn. This was such like a Netflix moment. I know you're telling me about your life, but it's like a crazy story. I didn't see that coming at all. I'm sure my listeners agree. But like the way I see it, and I can't wait to hear how you see it. Like the way I see it is, first of all, the hormonal changes of pregnancy. Like no one prepares you for it, and I see it in my postmenopausal patients. Like these women are going postmenopausal. They're leaving their careers. They're deciding that they can't drive anymore. Or they're severely depressed, and no one talks about the fact that it's hormonal. And then instead of kind of maybe treating the hormone piece or maybe the microbiome piece, now we've added antipsychotics or an antidepressant, which again, if we need, you need. I'm not against medication, but now that's just kind of, now we've added a whole new, that description of being like a prisoner of your mind, because now you're trapped with the medications as well. And then I could just imagine what was happening in your belly at the time as well. Like, it's just, oh my God, there's so many layers here. It's crazy. Like, I know you're super focused on the mind, but I'm also focused on what's happening to your hormones and your microbiome. It's crazy. So,
Which no one mentioned, by the way.
no, of course, it doesn't exist.
No.
None of this exists. So how did you climb out? What happened?
So when I got out of hospital, obviously I'd had like massive antibiotics. So that's going to affect my microbiome. When I got out, I'd lost a ton of weight, and I'd made that commitment to myself. That was my guiding force, right? I want to see my kids grow up. So I've got to get well. So then I saw a functional medicine doctor, started working on like basically trying to support myself, support my microbiome health, get myself back on track, eat healthily. And then from there, as I started building myself up, I was still having a lot of therapy. I saw so many therapists to try and like get a handle on things. I saw my gynecologist, and she was like, I'm convinced it's hormonal, even though like, or at least the trigger point was. The thing was, I'd got to the point though, where the psychiatrist said to me, no, we can't even call it postnatal depression anymore, because this is years on. You now have, the diagnosis was major depressive disorder with possible like links to bipolar. They didn't give me a bipolar diagnosis, but the fear was then, if you come off all this medication, could you trip into bipolar?
Okay.
So it was like medication for life. That's going to be the answer for you, so that you stay stable and we don't end up, which is actually it's really disempowering when you're told
you
that.
Think? Like, there's nothing we could do about it, so keep up in the med.
Yeah.
That's so disempowering. And then even if it is hormonal, you know, people are so scared to give people hormones. Like if you really think that like my progesterone is low, then why aren't we having a progesterone conversation? People are really scared of doing that. But I'm sure you know also at this point that serotonin and dopamine and everything you need for a healthy brain is going to be in your microbiome, and that's not anything that's discussed. Okay, so you met this functional medicine provider and you start fixing your microbiome, and then do you slowly come off meds, or is there more to it?
Yeah, so that was 2014 when I came out of hospital. Then I started working on my gut, working on my overall health, working on my mindset at the same time, like doing all the pieces. And then as I got better and I got fitter, got really into fitness, I then was like, I want to understand all the mechanics of this. So then I was like, okay, I'm going to do nutritional qualifications, personal training, health coaching, and try and figure out what was going on. And initially it was still all for me, right? I just had that really inquisitive mind.
Yeah.
And then as I started to get results, then I was starting to work with people. And then in 2019, I thought, I want more women to hear this. That's when I launched the podcast. And I thought, I'm going to get the best experts that I can onto the show and talk to them, which obviously you have been on and shared all your wisdom with my audience, which I'm super grateful for. And so then in 2019, the final piece for me at this point was I need to come off the medication.
Wow.
And I started that, I would say I started it in January of 2019, the transition off. And it took me to end of October before I finally came off it all.
So it took you a year?
Yeah, the best part of a year. Yeah.
So I have a question for you before we get, because I know then we have to talk about evolution of kind of like your business and what you do for others. But I just have a question for you. You know, it sounds like this spiral ultimately changed your career, right? I mean, and we're happy that you're here in this health space. But do you think if things were intervened or managed differently, you could have stayed in that career?
I don't know if I would have stayed in my career because I think the workload was so heavy that I wanted more time with my children.
Okay.
And I think that was a big driving factor. But I do think that there's a piece around when you leave, right? When you leave a career and you lose an identity, I think that also factored into mental health.
Ah, that is so true, right? Because you are this like amazing, whatever, fill in the blank here, with a lot of positive reinforcement, an entire identity of who you are. And suddenly, and it seems rather suddenly, right? It wasn't like, I don't know, it sounds like it was almost in a sense taken from you because of all this that you were grappling with, right? Like I imagine, I'm sorry, I've been putting you on the spot. I'm just thinking about it because I see it happening to my postmenopausal women as well. But it just seems like, you know, maybe if things were managed differently, then maybe it'd been like a gradual or like a part-time, I don't know, but like as opposed to like, I can't come back to this, like an all or nothing, like I can't come back to it. And so then having to deal with this identity crisis on top of it. I don't know if what I'm saying even makes sense.
Yeah, no, it does. And I think, you know what's really interesting, because now obviously I'm late 40s and I'm in that perimenopausal thing, is I think as well, the thing that I noticed, and is slightly off topic, is that like in perimenopause, if you've had problems, whether you've had PMS problems, if you've had postnatal depression, no one warns you that you're now also vulnerable to have these sort of mental health problems again. And so that has been a challenging thing because it comes up again later. And I don't think anyone really talks about that either.
Yes, that is exactly what I'm getting to. I feel like because we don't talk about the hormonal aspect of mental health, we'll go into our 40s and then suddenly be either depressed or anxious. Take medication, again, not against medication, but didn't really address the root cause and also didn't tell people like, hey, this is because you're estrogen. Like this, you don't necessarily have to retire early from your job or make, big changes. Like there's things that we could do about this. And I just agree with you. We're not really talking about women and their hormones and what it does to their mental health. Ever. Ever.
Ever. It's just a shame, right? It just gets glossed over all the time. It's like, oh yeah, that's just, and it's almost like it's a thing, right? Oh yeah, you've got PMS, or oh, you're postpartum,
right?
Or oh, it's perimenopause, and it's like,
and
but these are real things,
right? It's a real thing. Like I'll say about myself, like when I started getting more anxious, and I have someone helping me manage my hormones because I try not to manage myself, and it was very clear to her that it wasn't a sudden increase in anxiety; it was a drop in estrogen, and so by adding estrogen, my anxiety normalized, right? So we think of like perimenopause as hot flashes and night sweats. True for some, but also this. Wow, fascinating. This is like such an important topic. Okay, so you started with the podcast first, and then you started helping tell us about the transition into what is
so good question. So I started working with some clients, and then I started the podcast. Like initially I was working, one-to-one with clients, going close to them, understanding their world. And then I wanted to really expand my knowledge by interviewing the best, because you can take courses in things, right? But it's people who are at the coalface and also like have podcasts themselves or have authored books and gone really deep on a topic that I think you can learn the most from, right? Because they've really mastered that area. And so I wanted to give women in particular access to this information because there wasn't stuff out there really. Most of the, people, I got into a bit of biohacking as part of it. That was definitely a part. But if you look at the biohacking industry, it's mostly driven by men. And so I wanted to bring that information right to women and figure out how can we work with the female body for health and high performance. Because I reached this situation where, I'd had high performance, had loads of success, and then I'd completely destroyed my health. And then I had this time where I wasn't working at all. And now I had optimized my health, which was amazing. But I was like, how do I bring these two worlds together? There must be the ability to have that's why I called the podcast High Performance Health. How can you bring those two worlds together? And the more I've realized, just having been doing the podcast now the last 5 years, is health is literally the foundation of sustained high performance. You can't sustain high performance without optimal health. And so you can keep ignoring it, but ultimately, where's it going to head down to? Hormone imbalances, burnout, mental health issues, something's going to come, right?
So it's so interesting that you delineated, because I didn't, the language is subtle, but high performance is more, right? Just perform more, just bring in more, make more money, do more reps, hold your breath longer, whatever the heck is more. But that really has nothing to do, that actually could be detrimental to health, right? If you're just focusing on the performance. But if you're focusing on health, to your point, your performance will increase. And if you don't focus on health, your performance will inevitably decrease. Like you said, you were fine in your 20s, but then no, we're in out. Very interesting that, because we're so used to hearing that word peak performance, that we're not at what cost, and what are you focusing on, the performance, or are you focusing on the underlying health that can then produce performance?
Exactly.
So interesting. Oh my God.
And if you look at the law of entropy, right, it's you're always fighting that. It's not you can't say, oh, my energy was really low this year, so if I don't pay any attention to it, suddenly I'm going to 10x my energy next year. How is that going to happen? It's
manifest it.
Exactly.
I'm just going to think about it. It's going to come.
Yes, and then I'll attract it.
I'm a big fan of manifesting, but we need some realism here. That's so interesting. Oh my goodness. Okay, so then when did you come up with your acronym of your SHIFT acronym, and what is it?
SHIFT, basically, I created I wanted something simple, right? So it was how can I make the shift in my health? So it was pillars, so people can take it away. And, I can break it down for you if you want, so that people can go away and go, yeah, if I put these pieces in place, then I'm going to optimize my health and performance.
So what does it stand for?
Yeah. So SHIFT basically stands for sleep. It's the foundation of everything, right? We're not going to get very far. And that was the thing that burned me out, right? Pulling off all-nighters, not a good idea. So sleep and circadian timing is number one. And then the H is all around hormones, but not just, we've been talking about sex hormones, but what about your metabolic hormones, your insulin sensitivity? What about cortisol, stress hormone? What about melatonin? All these hormones, right? They need to be in balance, and your HRV is a part of that, right? So looking at the hormones of stress and the others. The I is the insights that you gather. So that's the centerpiece. What can I look at? What data? Whether that's through lab work, whether it's through wearables, whether it's through journaling. What am I gathering to show me, am I on the right path? And can I make changes? And then the F is, how do I fuel my body and mind? And that, again, the reason I choose the word fuel, not food, is very deliberate, because nutrition is one part, but what about light? Light has a profound impact. So if you think of fuel, you can think of just think of the word flow. So you have food, light, oxygen, water. If you master those, so you've got really good hydration with minerals, which is the W, so the water. You're breathing correctly. Even just breathing changes our physiology, right? So we can have anxiety because we're kind of hunched up like this. Yeah. And that creates a lot of anxiety in itself, even if we don't feel anxious. So proper breathing techniques, really fundamental. The L is light. I'm going backwards here, aren't I? So light affects, obviously, we know UV light affects vitamin D levels.
Only backwards in your head. We're just keeping up. Don't worry.
You're just keeping up.
Yeah, it's only backwards or forwards. You're the only one seeing it in your head. It feels perfect.
Oh, okay. Okay. You're just keeping up. And so the light is, so obviously vitamin D makes a difference from UV light, but then also looking at the infrared spectrum, the near infrared, that affects the mitochondria of our cells. So getting outside when we can access different spectrums of light, or biohacking it with red light devices and saunas. And then the F is the food, right? So looking at our diet you can look at your genetics, you can look at your microbiome, all the testing that you do, right, in your practice, so that it's personalized to you. How do I optimize my food? And then, so that's the flow, the fuel. And then the last T is, how do I train my body and mind? And the mind piece was the bit I left out, right? So I hadn't worked on myself, and not just mindset, but your own sense of connection and inner purpose, right? Your spirituality. and then training the physical body. So that those things are like, how do I make the shift? And you don't have to put everything in place all at once.
Yeah.
But
Not
it's a
everything at
formula
once.
to help
One
you.
thing at a time.
One thing at a time.
That's really important because you're going to get burned out trying to figure this all out.
Exactly.
One thing at a time, everyone. And the mindset, it's so interesting you said that because like the mindset piece for me with even in my own journey as a practitioner, the mind piece came last. Right. I was so focused on the microbiome, making sure the food's right, making sure the supplements are right, making sure the sleep is right, making sure elimination was right. And it wasn't until later on, and I think it's because when I first started out, I got really simple cases where if I just cleaned up their nutrition, they just got better. I was like, oh, I'm great at this. But as your name starts getting known, more and more complex people come your way. Mm. And as more complex people come, the tools that worked in your first year are no longer working in the second year. And it wasn't until I started getting back, like I no longer see patients one-on-one, but in my last year seeing patients, I was getting the most complex patients who have failed everything. And it was then that I realized that I had to start with the mind first, not mindset, with mind first. That if I wasn't helping them with their dysregulation and wasn't calming down like their constant fight or flight, there was nothing that I could do that would work. So it's very interesting, right? You skipped that part. I skipped that part for many years. My patients didn't need it. We were successful. So I don't know. For some people, they start there. For me, it took me a while to recognize that. And so let's go back to HRV. I don't think I've done enough episodes on HRV. I think I've only done one on HRV. And HRV it's not well known enough. And outside of getting a trackable, the rest is like up to you. Like you could really learn to do this. So tell us, like, what do you do? Like, what is your recommendation? We understand that HRV is this variability. Okay, so what? So what are we doing about it? What do you want us to know?
So what I guess I would want people listening is if they are tracking it, right? Let's talk about the different ways that you could track it and get access to that information because it's very inexpensive to do that. So you could use an overnight wearable. So for example, you could use, I have a Whoop strap or this is an ultra human ring or I do a great ring as well. And you could look at your overnight HRV and that would show you what's going on across the night. But the most important score that you will ever gather is your morning HRV reading. So within the first 20 to 30 minutes of waking. And so if you don't want to wear a wearable all the time, you can get something like a Polar H10 strap. Morpheus is a company that does a really good one. It's like $97 and they have a great app that shows you your HRV scores, your recovery and how you can optimize your exercise to improve it. And literally you just wet the strap and put it around you, put it on in the morning and take a 2.5 minute measurement. Unless you have a really low pulse of below 50, you would take it lying down and you just kind of gently breathe while you're doing it. And then you'll get your reading. And if you track that every single day, that will show you the most important thing is like, does it look like across 7 to 10 days? Because maybe you did a massive workout, right? And then your HRV drops a bit. But the key thing is, what does it look like across 7 to 10 days? Is it mostly around about the same? Because the difference between, say, an individual who isn't optimized and an athlete who is optimized is that they can take a very high stress load and still maintain a great HRV.
Interesting.
Because they're fitter, right? And they've got the right mindset. As you were saying, it's important. Whereas you can't just look down to what workout did I do? Because what are the stresses that are going on in your everyday life? How much emotional stress are you taking on? That psychological stress is going to impact it. Maybe your boss is really difficult to deal with. You know, we're just adding into this stress bucket. Maybe you're eating foods that you're really intolerant to. Maybe you got some microbiome problems. And all these things can add up, right, that are going to influence your heart rate variability. So it shows you ultimately, after everything that happened the day before, what's my capacity that I have today if I have a look at it? And how are the lifestyle decisions that I'm making changing it? One thing we do in our program is we give like a medical grade device where you can take assessments of, say, 24 hours or 3 days or 5 days. And this has electrodes. And the reason that we do that is it gives you information so you can start to see the things that are really stressing you out and the things that move you into recovery. And that always provides really interesting information because what might seem stressful to one person, right? So we have a mum in our program who she's got 5 kids. And when she had the monitor on, in the morning, before school, getting them ready, having breakfast, to one person that might be stressful, to her HRV was higher than in sleep, right? She's in the zone. She loves being a mum. It's so important. Yeah.
It's interesting. Okay, let me just make sure our audience is following. That is really interesting. I've never considered that. Right. So if we're saying HRV is kind of like this undulating Zen-like time, so we're thinking immediately like if I'm meditating, if I'm relaxing, my HRV should be at my highest. So one of the first points you said is that for someone who's athletic, they could be like whatever, lifting weights or boxing, but for the goal would be that their HRV still is undulating and there's still this high HRV even when they're under the stress.
Not when they're doing it. So they wouldn't. So as soon as your heart rate goes up, you'll see, because they have like an inverse relationship, you'll see heart rate variability drop. But say you take a morning measurement, they will be able to cope with that exercise load. And so they will maintain, they won't. So if someone's got like this picture where it's like high and then it's low and then it's like really spiky, they're not really managing the stresses in their life.
So if you're like level 10 fight or flight at work and then you come home and meditate and you bring it down, that's not the win. It's good, but that's not the win, right? The win is that they're able to maintain it. Yeah. Did I get it right?
Ideally, well, so like if you looked on one morning to the next, you'd be able to see some consistency in those measures, right? So some days it will drop and you've extended yourself and that's fine. But it's like if it's dropping dramatically, maybe that person who has a really busy job and they're stressed all day, but the meditation is enough to rectify things, right? Maybe it's not. And we would be able to see that and look at the data. And then you can introduce more recovery practices. So it might be like, okay, you have this really stressful job, but what about if it's not about meditation and for you going out for a walk just really helps facilitate you moving you into the green, right? And experiencing nature. Now we know 5-10 minutes, we can put that in multiple times a day. You're going to get fresh air, takes a break, resets your system.
But then the other thing you said, which is so interesting, right? That morning rush for one person is absolutely dramatic. For someone else, this is their Zen. So I love that because everything in life should be customized. And finding what gets you in your groove and being able to measure it is so powerful. It's so powerful. And then also your advice changes. Like for some person, like I'm going to tell you right now, if you send me to the woods and tell me to calm down, that's not my happy place. First of all, I'm allergic to everything. Second of all, I don't like bugs. My wife her HRV will be like so high and my would be very low. When am I getting out of the woods? Take me out immediately. That's so interesting. I love that. I didn't even consider that. Wow. So interesting. So you use that as part of your tools and then you teach people or get to know what works in them, because the more times you tap into these moments of HRV, the better we get at it.
Yeah, the more that we can learn how to regulate our nervous system, it just impacts our health and our energy really dramatically, right? So we have more mental capacity, we have better physical capacity to show up for everything that's going on in our lives. And we feel more balanced, right? So we can bring a lot of those hormones, because even when you look at like cortisol, it's not great to have high cortisol on a constant basis. It's very catabolic in nature, as you know, but it also affects your blood sugar. So if someone's highly stressed, quite often they're not managing their blood sugar that well. And then they're eating badly because they've got these highs and lows, you know, and then their energy is mirroring those blood sugar highs and lows. And you just get this cascade.
So much. What do you want to tell our audience? Maybe I haven't asked you.
I think what I would say is we've talked about a lot of things very quickly, right? In a short space of time. And we've packed a lot in.
Just
and
because
I think
everyone's attention span is like...
Yeah, this is so short. So I think what I would say, because I don't know when this is coming out, but we're recording it in late December. So whenever it comes out, I would say, just reflect. And like you could sit down and just write shift across the page, right? And go, okay, sleep, hormones, insights, fuel, training. Like how can I score myself on each of these areas? We have a quiz we can link to that will help you do this and ask you some questions and send you some free report and scores. But you could just put it on a sheet of paper as well and try and score yourself. Like, where am I on these areas? And if you think, actually, my sleep is really low, like I keep binging Netflix and I never get to myself to bed on time. And then I wake up groggy and I don't get access to fresh air. You could say, okay, this is a low score. I'm going to pick this first and I'm going to really try and optimize my sleep. And then work your way through. Just start with something really simple that is the most need. And I think what I would say is that one thing is like your domino, right? Because it knocks down the other ones. So one of those letters for you is going to be the most important, that it now pushes the others down. Because if sleep was the thing, you're now more likely to go and eat better. You're more likely to go and train and do the fitness. It's going to knock the others down. Whereas for another person, they might be like, I never sleep well unless I've done lots of exercise. My mindset's really poor. I don't eat well unless I'm exercising. Great. Let's pick the training of the physical body before we move on. And then maybe you can train the mind, but that will be your domino. I would just start that.
That's so great. And it takes away that pressure of having to do it all at once. That is so good. And you can just focus on one thing at a time and watch the other things fall into place, or not, or you could just do one and then go to the next and then go to the next if it doesn't all fall into place. But it makes it more digestible. I love that.
Exactly.
We don't need to overwhelm our women anymore.
We definitely don't. We definitely don't.
We definitely. So do you work with people anywhere, all over the world?
All over the world, yeah, we do. In our programs, I work, same as you, in group programs. I find that women in particular just make amazing communities, and they make friendships and they support each other, don't they? They just support each other. It's incredible.
It's really fascinating to watch. They're just always willing to like share a tip or a trick, or you can call me and I will be your support person. And then they can from different parts of the world, and it's like innately collaborative. It's amazing to see women just collaborate without any they just are. It's amazing to build a community around women. I love that. I love the men listening too, but it's just a different skill set. You guys have to learn it. For the women, it just comes in automatic. It's
factory setting.
Factory setting.
I love that.
Oh my goodness. Oh my God. Angela, I can't thank you enough. There was so much here. I'm going to make sure we put the link to the quiz as well. I'll have someone reach out to get that from you. And please, anyone listening, if you're burnt out, if you've identified with the story, reach out, get the help that you need, because it's different plans for different people. And sometimes they're going to listen to you and be like, oh my God, everything she says is me. And I'd be so happy if that connection is made. It's so good. Yeah. Thank you for being here.
Yeah, my pleasure. Thank you for having me on. It's been great. It's been great to chat.